to discuss mouthwash, microbiome disturbances, and how that increases the risk of prediabetes and diabetes. And here's the article, which is actually quite fascinating. Does everybody see this?
Yes, good.
Okay.
Yes, we do. Yep.
So this is an article that came out a couple of years ago, and it's about over-the-counter mouthwashes and how that affects prediabetes and diabetes. And what they really concluded is that if you have frequent, regular use of over-the-counter mouthwashes, it is really associated with increased risk of developing prediabetes and diabetes. Now, why does that happen? Well, there are bacteria in the mouth. They're sitting in the little cover of dental plaque. It's just an accumulation of minerals and bacteria sitting in a mesh, both on the teeth and inside the gums around the teeth. And that is implicated, as we know, in the pathogenesis of a whole number of oral diseases. We've known that forever. And so what do? Well, one of the things we do besides brushing, etc., is that we use mouthwash. And a mouthwash contains antibacterial ingredients, and some of them a tremendous amount and very high strength antibacterial ingredients. And for many people, it is a very popular adjunct to mechanical plaque control. And what is mechanical? That is flossing and brushing your teeth. And what they tell you is, well, yeah, it reduces the oral bacteria and it improves oral health, which is true. There's no doubt that it does that. But here's the other part of it. In a sense, mouthwash is like a weapon, as David Perlmutter said, it's a weapon of mass microbial destruction because it operates in a totally indiscriminate manner. It's decimating harmful bacteria and beneficial bacteria alike. And that's where the trouble starts. So that is important, which we'll discuss in a few moments, because it impacts oral bacteria that are, yes, doing harm possibly to the teeth and gums, but those oral bacteria, many of them, the good ones, are critical for nitric oxide formation. And you're going to ask, well, what is that? Well, we'll discuss that in a moment. And it creates a problem for metabolic disorders, including prediabetes and diabetes. And so the aim of the study was to look longitudinally, meaning over a period of time, to evaluate the association of these over-the-counter mouthwashes and the development of pre and actual diabetes over a 3-year follow-up period. And so the participants used mouthwash twice daily. Now remember, the twice is important, twice daily as a baseline. And they had, think of this, of 55%, over 50% elevated risk of prediabetes and diabetes compared to less frequent users, or close to 50% compared to those who did not use mouthwash at all. That's over the 3-year period. And this was an effect that was similar even if you added income and education, oral hygiene, sleep breathing disorders, diets, medicines that they were using, as well as fasting and 2-hour post-glucose challenges. So in other words, it didn't matter who you were and what you were doing, what your socioeconomic situation was, same result. The effects also were very significant among those who never smoked, and more importantly, about those who are obese. And that is very important. And we'll go over that as well in a few moments. So mouthwash use less than twice daily showed no association, suggesting that, okay, if you use it less than twice a day, there's a threshold effect, and this large increase in risk doesn't happen if you use it less frequently. So what's the conclusion of the study? That frequent, regular use of over-the-counter mouthwash was associated with increased risk of developing prediabetes and diabetes, especially in those who are overweight or obese. And that is important. So why? Why is this happening? Well, mouthwashes, as I said, destroy harmful bacteria, but they also destroy beneficial bacteria, such as Veillonella, Neisseria, and there are a group of others. Now, what do? These bacteria produce nitric oxide, and nitric oxide is crucial for regulating insulin synthesis and secretion. And because of that, it is crucial for really regulating blood sugar levels, because what they do is they convert what you have in a diet, which is nitrate, converts it to nitrite, and then that is converted to nitric oxide. And for those of you who heard my lecture on uric acid and so on are going to know about some of the other things that nitric oxide does. But the production of this, if you kill these bacteria, the production of nitric oxide is impaired. So it indirectly affects insulin sensitivity. And this contributes to what we know as insulin resistance. It's part of the metabolic syndrome, which is a key feature of type 2 diabetes, which is a scourge. It's an epidemic throughout the world and definitely in North America. So we do know, as I mentioned, nitric oxide has a similar association with hypertension. And so mouthwash and its use increases risk for hypertension as well, because nitric oxide, we know, causes arterial vasodilation. It opens up the blood vessels, and that increases blood flow. And when you increase blood flow, you lower blood pressure. So if you destroy the ability of nitric oxide to do what it does in the body, you are going to increase hypertension. And now we know about many other things it does. It will increase the risk of type 2 diabetes. So what are the takeaways? The takeaways here are the potential mouthwash to diabetes link, which underscores the importance of maintaining a balance, not only, remember this, not only in oral microbiome, but in fact, the overall microbiome. And remember, the oral cavity is a part of the body. And the oral cavity, in fact, is the initial part of the gastrointestinal system. Don't separate that out from the rest of the body. What happens in the mouth is going to affect what happens in the rest of the body. So there's a delicate balance between controlling pathogenic oral bacteria without eliminating the potentially beneficial systemic effects of the commensal oral flora bacteria. And that must be considered before these products are prescribed or recommended for routine use. And last but not least, the challenges of diabetes, as well as other diseases, dysfunctions, should focus our attention of how everyday habits can impact health and what are the strategies required to find the healing opportunities.